Today we'll talk about recent advance in the efficacy and safety of progesterone in miscarriage. Okay, the progesterone is an essential hormone for conceptions and maintenance of a pregnancy. Progesterone usually secreted by the corpus luteum in the ovary. It is needed to prepare the endometrium for implantation of the embryo, thus plays a crucial role in achieving successful pregnancy. After implantation, progesterone contributes to the maintenance of the pregnancy by modulating the maternal immune response, reducing uterine contractility, regulating the uteroplacental circulation. After around 12 weeks of pregnancy, the placenta usually takes over the role of progesterone production. Therefore, progesterone deficiency can associate with early pregnancy loss. The pregnancy outcome, what happen, the role of progesterone, how it is prevent early pregnancy loss. Fetus at trophoblast, there is 50% paternal origin and 50% maternal origin. They will produce a pre-implantation factors. The progesterone inducing blocking factor at the decidual level, and the progesterone peripheral blood mononuclear cells level. The progesterone level sufficient to form progesterone inducing blocking factors is that will cause asymmetrical antibodies Th2 bias NK cells, and this that will cause fetus protections and delivery. If there is insufficient progesterone level, that is insufficient production of the progesterone induced binding factors, induced blocking factors, symmetric antibodies Th1 bias LK cells, natural killer cell activators, that will cause cytotoxic inflammatory reactions and abortogenic reactions that will cause abortion. What are the formulation currently available for progesterone? One is injectable progesterone, vaginal progesterone, oral progesterone, injectable intramuscular subcutaneous route. The injectable that will cause sufficient secretory transformation of the endometrium, avoid hepatic first-pass metabolism, adverse effect, injection site pain, abscess, irritation, and inflammatory reactions. The vaginal progesterone you well tolerated with adequate endometrial secretory transformation, avoid first-pass metabolism, vaginal discharge, irritation is the risk side effect. Oral progesterone is the easiest route, most acceptable route. What are the recent study, all the evidence that we collected to from 2009 to 2024? First thing is the prism trial, the promise trial. Promise is the first time is progesterone in recurrent miscarriage trial. First trimester progesterone therapy in women with a history of unexplained recurrent pregnancy loss. It is a randomized double-blinded and placebo control trial, international multi-center trial and economic evaluation. Patient in this study group received 400 microgram of micronized progesterone twice daily from the time of a positive urinary pregnancy test until 12 weeks. The follow-up rate to primary outcome was 826 out of 836. The live birth rate in the progesterone group was 65.8%, and in the placebo group it is 63.3%, and the relative risk is 1.04, 95 confidence interval. In the subgroup analysis, there is no significant trends toward the increased efficacy with increasing number of previous miscarriage. The second trial is the PRISM RCT, the PRISM trial. The progesterone to prevent miscarriage in women with early pregnancy bleeding, PRISM RCT, that is 2019. The PRISM trial is also a multi-center randomized double-blind placebo-controlled trial. It involved 4,153 women with vaginal bleeding in early pregnancy. Women are randomly assigned to receive vaginal suppository containing either 400 microgram of progesterone or matching placebo twice daily from the time which they present to till 16 weeks they serve. The primary outcome is live born baby after 36 weeks of gestation. The results, the incidence of live birth at least 34 weeks of gestation was 75%, and in the placebo group is 72%. For women with one or more previous miscarriage, the live birth rate was 75% compared with the 70% those with placebo group. The potential benefit appear to be more strong for women with 3 or more pregnancy previous miscarriage, what a live birth rate 72% compared to 57% in the placebo group. This is the live birth rate is comparatively high in the progesterone group. Okay. Then this is the progesterone for women with threatened miscarriage. This top trial, a placebo controlled randomized trial. In these trials, the same things they have done. Eligible pregnant women under 10 weeks of gestation experience a threatened miscarriage as apparent from a vaginal bleeding were randomized into two groups. 1:1 ratio. Intervention group received 400 milligram progesterone as vaginal pessary. The control group received placebo vaginal pessary both until 12 weeks of gestational age. The primary endpoint was live birth. This the result of the study, the live birth rate were almost similar. There is once this did not show any significant difference. Then this Cochrane review 2018 progesterone compared to placebo to no treatment for treating with threatened miscarriage. Women with threatened miscarriage, there is a high Germany, Italy, and Turkey. The multi-center trials. Cochrane review shows oral progesterone probably reduce the miscarriage rate compared to the no treatment, while treatment with vaginal progesterone demonstrate minimal reduction in the miscarriage rate. Effect of progesterone for women with threatened miscarriage, a systemic review and meta-analysis. The progesterone for women with threatened miscarriage, top trial. Already I told progesterone has a benefit, may have benefit on live birth rate and miscarriage rate for women with threatened miscarriage. This benefit appear to be confined to the use of oral progesterone, and no statistical significant improvement was seen with vaginal progesterone. Another trials is trauma trial, the randomized control trial for micronized progesterone and dydrogesterone for threatened miscarriage. The study investigated 141 women presenting with threatened miscarriage who were randomized into either micronized progesterone or dydrogesterone therapy. The post-treatment bleeding pattern self-reported side effect on day 4 and 10 therapy. The occurrence of spontaneous miscarriage at 16 weeks were available. The result demonstrated that the extent of bleeding at day 4 and 10 of the treatment and subsequent miscarriage rates were comparable between both micronized progesterone and dydrogesterone. That the study also showed that the risk of miscarriage in women with low serum progesterone level, those patients has low serum progesterone level, those have higher risk of miscarriage compared to those who have a high progesterone level, regardless the treatment type. Effect of micronized progesterone on fetal placental volume in first trimester threatened abortion. Compare the effect of oral micronized progesterone on the first trimester fetal placental volume using 3D use ultrasound in 60 women with threatened abortion and a singleton pregnancy. After treatment, the oral natural micronized progesterone has significantly higher placental volume than in control group. Main difference is GSAC, amniotic sac, embryonic volumes between the oral natural micronized progesterone group and the control group were similar. The progesterone for preventing miscarriage, a network meta-analysis. This was a recently published article in 2021. The 7 RCT involving 5,682 women concluded that vaginal microprogesterone may increase the live birth rate for women with a history of one or more previous miscarriage or and early pregnancy bleeding compared to placebo. However, in women with no previous miscarriage and early pregnancy bleeding, there is a little or no improvement in the live birth rate when treated with the vaginal micronized progesterone compared to placebo. The quality of the evidence of the dydrogesterone compared to the placebo for women with recurrent miscarriage was low certainty, therefore the effect remains inconclusive. There was no data to assess the efficacy of the 17-alpha hydroxyprogesterone or oral micronized progesterone of the outcome live birth in the women with recurrent miscarriage. The ESRE, what are these are the recent guidelines? What are they saying? ESRE guideline, recurrent pregnancy loss, and update in 2022. They told the vaginal progesterone may improve live birth rate in women with 3 or more pregnancy losses and vaginal blood loss in a subsequent pregnancy. Progesterone in pregnancy, this is evidence-based strategy to reduce miscarriage and enhance assisted reproductive technology. Evidence-based recommendation for use of progesterone in threatened miscarriage. Evidence-based, what is the evidence regarding role of progesterone in threatened miscarriage? First, the testing is not required. When the threaten is diagnosed or confirmed, the oral dydrogesterone is recommended 40 mg followed by 10 mg twice daily. The above regimen should continue for 1 or 2 weeks after the end of the clinical symptoms of the miscarriage. Like mostly though, we have to continue 7 days following the bleeding stuffs. Okay, evidence-based recommendation for the use of progesterone in recurrent miscarriage. Evidence-based recommendation is testing progesterone levels are not required. When pregnancy is confirmed, vaginal micronized progesterone is recommended 400 mg twice daily. Threatened, you go oral progesterone. Here there is recurrent miscarriage, you can give vaginal progesterone. The regimen should continue until the pregnancy reaches 20 weeks of gestational age. ACOG 2020 consider offering to women with vaginal bleeding and a history of 1 or more previous miscarriages a course of treatment with vaginal micronized progesterone 400 mg twice daily, started at the time of presentation with vaginal bleeding, continue till 16 completed weeks of gestation. ASM 2012 telling administration of progesterone to women with sporadic miscarriage is ineffective. However, in patients with 3 or more consecutive miscarriages immediately preceding their current pregnancy, empirical progesterone administration may be some potential benefit. NICE 2021, NICE updated clinical guideline that cover the management of threatened miscarriage in the first time. So, the recommended offering vaginal micronized progesterone 400 mg twice daily until 16 weeks completed gestational age. Those with previous miscarriage and vaginal bleeding, however, the duration is still not evidence based. If the fetal heartbeat is confirmed, continue progesterone until 16 completed pregnancy. Okay. The Foxy guideline for threatened miscarriage, women may be treated with micronized vaginal progesterone 400 mg per day until bleeding stops, or oral dydrogesterone 40 mg loading dose followed by 20 to 30 mg per day until 7 days after bleeding stops. Okay. Okay, then as per the RCOG guidelines, RCOG recurrent green top guideline number 17, the telling progestogen supplementation should consider in women with recurrent miscarriage who present with bleeding early pregnancy. For example, 400 micronized progesterone twice daily at the time of bleeding until 16 weeks gestation age. The PRISM trial, they recommend this recommendation from the PRISM trial reported no significant difference in live birth rate with the early pregnancy bleeding, but however, in the subgroup analysis, the recurrent miscarriage as a significant improvement in live birth rate was observed. Routine supplementation would be used with cautions in asymptomatic women with unexplained recurrent miscarriage. Meta-analysis have reported possible benefit of progesterone supplementation. However, there is a lack of consistently demonstrable benefit when used routinely in women with unexplained recurrent miscarriage. There remain uncertainty about the optimal specific drug, route, timing, and dose. Promise trial, the largest multi-center acid to date, up to which was adequately powered with very low risk of bias, so that routine progesterone supplementation improve live outcome. The FIGO good clinical practice recommendation for the use of progesterone in the management of recurrent past times makes correct. Progesterone supplementation during the pregnancy is generally not recommended as a no beneficial impact on the first time recurrent miscarriage has been shown. As there is no clear evidence of any fetal abnormality, there is no fetal abnormality of the progesterone supplement in pregnancy. Oral injectable vaginal rectal types prescribed it is on an empirical basis as part of research trial is not contraindicated. As there is no clear evidence of safety concern regarding progesterone supplementation in pregnancy, like oral injectable vaginal prescribing it to empirical basis as part of research is not contraindicated. Oral progesterone supplement during pregnancy can be considered as there is some beneficial impact on the first time recurrent prescription. Preconception oral progesterone supplementation is not recommended in the management first time recurrent miscarriage. There is no evidence based published study. As there is no clear evidence safety concern, you can continue. Prescribe daily dose 20 mg oral progesterone would be happy to optimal. How the limitation trial procedure. Vaginal progesterone is not recommended. There is no beneficial impact in the first time recurrent miscarriage. Preconceptional not recommended. No clear evidence any fetal abnormality. If you giving, then prescribe dose 400 mg. Recommended rectal dose also not recommended. Injectable progesterone did not recommended. No beneficial impact. Preconceptional injectable progesterone not recommended. Then current management recommended recent guideline 2020-22 vaginal mechanism progesterone with vaginal bleeding and a history of one or more previous pregnancy loss 400 mg twice daily starting at the time of presentation with vaginal bleeding and continue until 16 completed with gestation age. Women with history of 3 or more previous pregnancy loss, you have to start 200 mg twice daily starting at the time of presentation with vaginal bleeding, continue until 12 weeks completed gestation age. Being any if any vaginal bleeding, then you have to give 400 mg twice daily. Continue until 16 completed weeks of gestation. 400 twice daily. If it's a history of one more pregnancy loss with vaginal bleeding, it was to 3 or more pregnancy 200 mg/d. Or if it is continue until 12 weeks, if it is bleeding with previous miscarriage 3 or more, then you give until 16 weeks 400 mg/d. Safety of progesterone, a meta-analysis of 7 RCT involving 5,682 women, including that there is probably no difference in congenital abnormality and adverse drug event the vaginal micronized progesterone for threatened or recurrent miscarriage compared with placebo. In both PROMISE and PRISM trial, there is no evidence of short-term harm or an increased risk of congenital malformation in women taking micronized vaginal progesterone. Higher Hilger et al. This study is to compare the fetal outcome between the pregnancy that received natural progesterone supplementations. Those in the study show that there is no significant difference in the incidence fetal and only both chromosomal and non-chromosomal. In case control study, progesterone supplementation was the increased risk of hyperspadesis or residual. However, the history of intake was evaluated by maternal interview after birth with a risk of recall bias. The long-term effect of prenatal resistant treatment on the child development behavioral health system and another based on long-term effect, prenatal exposure, neurophysical development and hospital admission among twin up to 8 years age, so that use of progesterone in second, third time did not have any long-term harmful effect. In utero exposure of 17 alpha hydroxyprogesterone coupled risk of cancer offspring. The study investigated total 1008 offspring who were diagnosed with cancer over a 1800% year follow-up. Among these individuals, approximately 1% had prenatal exposure to 217 alpha hydroxyprogesterone coupled. First time to use associated increased risk of all cancer. The risk within number of injection given. Exposure to second or third time show that male offspring had an additional risk of cancer compared to female. The risk certain such as prostate, colorectal, brain cancer are higher. 70 alpha is glucose intolerance in pregnancy. Systematic review on meta-analysis 6 study, each 4-year cohort study reported that incidence of abnormal glucose test result, gestational diabetes mellitus was higher in women with singleton pregnancy. exposed to weekly even progesterone captured for the prevention of recurrent miscarriage. The impact of oral intake of progesterone fetal head development during early pregnancy. In this case, consider comparing 2,202 children born with congenital heart disease and control group consisting of 200 children. The use of dihydrogenation in early pregnancy was found to have congenital heart disease in the substring. The most common adverse effect by taking oral natural or micronized is oral natural micronized progesterone for obstetric indication of drowsiness, somnolence, dizziness, sustained release formulation. Oral natural progesterone have been reported well tolerated as well as lower rate of drowsiness, dizziness. Tachycardia cardiomyopathy associated with dihydrogesterone, delayed fulminant hepatic failure, dihydrogesterone related in vitro fertilization therapy, recurring lipotension during pregnancy. Conclusion: Present essential lifestyle and mental in pregnancy. The current evidence regarding the efficacy of progesterone in miscarriage remain inconclusive. Data so far says that there is no benefit of using progesterone in women with threatened miscarriage without history of previous miscarriage. However, in this presenting those patients presenting with bleeding in early pregnancy with history of previous miscarriage, progesterone therapy may be effective in improving life birth. The apparent tolerability safety profile of progesterone using early pregnancy also makes it an acceptable treatment choice for threatened miscarriage. Single pregnancy women are at a high risk of miscarriage are encouraged to inform side decision making. Further study to answer questions as the most appropriate indication use, preferred doses, route administration, duration, treatment cost using progesterone. Progesterone should be used with caution with cardiovascular disease in patients with impaired liver function, cholesterol. Thank you.